All right. Hi, everyone. Welcome to tonight's webinar where we'll try to highlight what we've really feel like our biggest accomplishments were for 2022 and forecast what we see happening here at Michigan Center for Regenerative Medicine in 2023. Dr. John Santana, Dr. Thomas Navity, and I guess welcome to the webinar. Thanks for joining us. So
first of all, I want to thank all our webinar viewers, all our past patients, everyone who's put their trust and faith in Dr. Navity and I to help them all throughout 2022 and the previous years. It's been a blessing that you guys trust in us and believe in kind of the message of regenerative medicine. And I'm glad to report that we've had a very successful year.
Yeah, we did. Both from a volume standpoint, a growth standpoint, stabilizing our new clinic and filling that with patients and as well as with outcomes.
Yeah.
I would say starting with one of the things I'm proud of us for in 2022 is our reporting to a central registry. We use both a registry that comes with our Gray Ledge laboratory, as well as one that's national and open for anyone that wants to report to. And proud to say that combining Dr. Santana and I's numbers, we were the number one reporting clinic in the country. So we reported more data to that dashboard and to that database than anybody else. And I guess why is that important?
It's especially with the technology and this field of medicine that's so new and there's a lot of information around, having data to show patients and everyone essentially that what we do makes sense. What we do counts and actually helps people. And I think that's what the data registry talks about, because it's not something where just him and I kind of tell you, yeah, it's going to work. Here is hard facts that tells you that this technology works.
Yeah. We've done a great job, and our patients have been wonderful about sharing their experiences and their stories and taking the time to make a video and do a testimonial. But that's not science. Testimonials, one off, two off. Mm-hmm. There's always great, wonderful miracle stories out there in medicine. But for us to make scientific decisions off those very few case examples isn't great science. So the best we can do is pool that data together and do so in a way that's a structured system of in this case, using data biologics, either emails or text messages, were what are called validated surveys that have been and tested to show that there's a validity from patient to patient and how they're answered, and looking for mainly three major outcome points. So how well are people doing functionally? How much better are they getting from a pain standpoint? And is anything bad happening? Are there any adverse outcomes from doing these procedures?
And then they do these surveys at certain points in time. So before we do the procedure, you get a baseline score of your function and your pain. And then after that, there's a follow-up after a week, 3 weeks, few months. And then I think as far as we're looking at now, over a year.
Yep. And with this new, what's called a dashboard or the initial screen when you log into this platform, we are going to have a very powerful education tool with our patients, where as part of the consult, we can dial in, just like you can really any search engine specific variables, how old is the patient and what other medical problems might they have, called comorbidities, how severe is their disease.
Right.
In other words, how good of a candidate are they?
Yeah.
Based on those variables, what kind of an outcome can we expect to get?
Yeah. So that's on the way. It's probably not there yet. We definitely need more numbers to get that clear. But yeah, that's one of the goals that we want to have with this data biologics registry, and even just kind of comparing ourselves to other clinics in the area. So places like Mayo Clinic, Cleveland Clinic, or other regenerative medicine places too. Then we'll be able to compare ourselves and our numbers from them. We pride ourselves at kind of keeping step by step with everyone else in the industry, making sure we're staying ahead of the technology that's out there and making sure that we're be able to offer the best treatment that we can for our patients.
Yep. And to really answer that question of, should I be using platelet-rich plasma for this? Should I be using bone marrow-derived stem cells for this? What about adipose-derived stem cells? Are they better than bone marrow? Should we be combining things together? All of those questions with enough data can be answered using this platform, which has been built. And now we just need our clinic and lots of other clinics to continue to pour data into this open platform. And I think we can show you a sample of what that's going to look like. If you give us just a few seconds here, we'll be able to pull what that dashboard will look like. And again, I think it's going to be a nice, powerful tool for us to use in the consults to be able to log in, pull up on a screen, and show patients that your outcome very well likely will be similar to what we're seeing here. So on this screen, you can see 3 basic bar graphs. The first at the bottom is a look at patients' disability scores. So as you can see, the first level is higher than the outcome at 18 months. But the problem with, I would say, and being the biggest critique of this data so far is if you look at the number of patients, the N numbers, they're still quite low. Sorry, I'm told that we haven't been able to get the screen up. So that might be something we save for a future webinar or another explanation where we dive deeper once this is really live. It's definitely a big goal of ours to start using this to show patients disability scores going down, pain scores going down, functional scores going up, and then being able to toggle or to change different variables and really pick the best treatment for them, not just based on our personal experiences, which is still very important, but based on real life data. Yeah.
So you can tell, great doctors, mediocre IT, but rest assured we're good at what we do. The one thing that kind of jumped at me when we were kind of reviewing the data biologics was, the functional scores that we were getting from our patients at 6 months. It's 84% improvement, so which is really nice to see.
Yeah. So that was kind of one of our big I guess sales or our selling points from tonight is that functional improvement is as important, if not more important, than pain reduction. Not only people feeling better, but they're functioning better, which is really what most of our patients come to us with goals of wanting to do more. I guess transitioning to another topic, we mentioned it earlier. We added 2 different injection options for our patients getting stem cell procedures.
So one of the things that we added is adipose stem cells. It's I'm sure a lot of patients who are already looking into this technology probably came across some articles or some news on adipose cells. And right now here at Michigan Center for Regenerative Medicine, we do primarily bone marrow stem cells. But since the advent of adipose cells coming up as showing really good data, really showing good outcomes for shoulders and knees and other issues, orthopedic issues, we've adapted this as well. So we started offering this too. So from our initial results, we started offering around October-November timeframe of 2022. The handful of patients that we've had who've tried adipose are very happy with it. The outcomes are pretty good. We've done both of those procedures just under local, which is kind of nice. You don't have to be sedated for them. Patients kind of enjoy getting fat off of them and then kind of injected it and repurposing it for pain in their shoulders and their knees. And the outcomes have been really good. So data shows preliminary that there's more stem cells per volume in adipose tissue. So that's kind of nice to see. I think fat has a few more ways to go as far as finding qualitative numbers on fat. But so far, from a patient point of view and a subjective point of view, it's working pretty well.
Yeah. So I echo your comments. I agree. I think fat is an awesome additive to what we have for our patients. Another alternative. Pros, certainly the density or the volume, or excuse me, the concentration seems to be higher than when we pull from bone marrow. Downside is our volumes aren't quite as much. So if you multiply volume times concentration, that's where you get quantity of cells, which is really what ultimately comes down to. And then the quantification process. That's the limiting factor that our lab that we utilize here, Grail Edge Technologies, is working on a quantification system so that when we're giving, one of the things we pride ourselves with is when we're doing procedures here, we can give you a dose. We can tell you what we injected and how many cells we injected you with, which is one of the variables that makes an important determination in outcomes.
Yeah,
It makes sense. If you don't inject enough cells into the structure, you're not going to get a great result. And if you don't count the cells, you don't know whether you injected enough or you didn't inject enough. So it's important to do a quantification step, a counting step.
Yep. So the quantification part with the lab, and also adding this on to our data biologics registry too, seeing what the outcomes are on, bone marrow stem cells versus adipose versus PRP. Like Dr. Navdi was alluding to, in the future, we'll be able to tell you, like, hey, for this type of injury, for this age, this is the go-to treatment for you. And over here, we're starting to kind of create our own protocols. We've kind of, anecdotally, we've kind of think we know kind of where things fit, but having that hard data and really seeing, objective data is going to be nice to see in the future.
Yeah, keyword, objective data, not just subjective, me telling you, Dr. Santana telling you, our patients in their own words, giving testimonials telling you, but real numbers, objective numbers that validate those statements that we're making.
Yep.
And then
next,
Dr. Santana, I want to credit with our next biggest accomplishment in 2023, or 2022, really encouraging me to start incorporating intraosseous injections. So Dr. Santana did our first intraosseous procedure here, and I was taken aback by how doable it is, how easily it was to incorporate into our process. So walk us through what that looks like.
Part of the things that we always like to do, and we pride ourselves in when we have our patients, that we want to give them the best technology and the best information we have regarding regenerative medicine. So one of these techniques is intraosseous injections. It's been around for a while. It's one of these things where we were kind of thinking, well, it's kind of very specifically you treat it for subchondral edema, subchondral cysts, or avascular necrosis, really specific type of things like that. But the more we kind of looked at the data, the more we kind of did our research, knowing how histologically the subchondral bone is important as far as helping the joint and the cartilage in the joint to regenerate and grow, and getting that nourishment is in there. It just made sense for us to treat moderate to severe osteoarthritis with an intraosseous approach. That we were not just treating it at the joint, but also we're treating it at the subchondral bone itself, helping that cartilage layer to grow some more. So when we started adding this to our protocol and our treatments, it's just tremendous, like how the outcomes have been. Like patients where we thought were just too far gone to have a regenerative medicine procedure, and now, hey, maybe there is a chance that this is going to get better.
Yeah. So. That subchondral bone and the type of cartilage attached to those bones, we always think of them as being separate structures.
Yeah.
And that's one of the new breakthroughs that we've had. Is it's really a confluence of cells from the bone to the cartilage, and it's not a delineation to it. So I like analogies that makes most sense to me, and in my mind, this is very much like leaves on a tree. And the root system is the bone, and what we want to grow is more leaves, and that's the cartilage. If that's the case, we have fertilizer. Where do we put it? We spray the leaves, or we put it into the root. And then in the case of the subchondral bone, when you inject those stem cells into the root, it helps that cartilage grow from the inside out.
Right.
And we get a much more robust cartilage growth, which if you have very little cartilage to begin with, that's where now we're starting to incorporate those procedures, even if you might not have those other structures like subchondral edema, a subchondral cyst, or avascular necrosis.
Yeah, it's actually something from, we have to kind of salute one of the pioneers, Dr. Hernigu, is the one who kind of created this intraosseous technique primarily for hips and AVN. And in these initial studies from 2009, it showed out of 500 hips, I think only about 90 ended up getting a hip replacement doing this technique. So those are fantastic numbers.
Yep.
So,
Good odds. So the technique itself, once you have a good handle of the anatomy and are comfortable with needle driving, such as ourselves, it's really not a complicated procedure for the hip, the knee, or the shoulder.
Yeah. And then recovery-wise, it's actually not any different than our typical intra-articular procedure. That's probably the biggest surprise I have is after the procedure, patients are able to walk out like normal, and even though we're going through the bone. So it's a really nice thing to see, kind of that real world outcomes from what we read and apply to from bench to bedside.
And before we did it on our patients here at Michigan Center of Regenerative Medicine, both Dr. Santan and I took training courses through a society called the Interventional Orthobiologics Foundation, and pioneers again in our field, people we need to give a debt of gratitude, people like Chris Centeno, and developing this training process so that we can spread the word and spread the way, the injection techniques at least, that we are finding best and most useful. And in last year, Dr. Santan and I both have done almost the entirety of the Interventional Orthobiologics Foundation certification courses. And now that society is expanding and looking for additional partners and training facilities. And we're happy to announce that we've been selected as one of their training facilities. So in 2023, we'll start training other physicians from around the world, in particular in the Midwest, on how to do these procedures, do them safely, do them accurately, and get the best outcomes.
Yeah, so it's not just competency that we're able to show; it's also expertise in the field. So, which is again, thanks to everyone in IOF and Toby and all these other places that allow us to learn all these techniques.
And we're very passionate about sharing that. Our true belief is that this is a rising tide of an opportunity for patients to get better and physicians to use a less invasive approach to help patients get better. And the more physicians that we can treat who are well trained, we can train who are well skilled in delivering these regenerative therapies, the better everybody's going to do. Patients especially, but physicians included. This is a revelation in a treatment opportunity for people, and there's going to be more patients than either the two of us or any other physicians that end up working with us can treat. It truly is a very large patient pool that can benefit from these procedures.
So piggybacking off of that, one of our goals for 2023 is to establish a training program. So IOF is one avenue, so you can go through IOF and train here in our facility. But even just here at the Michigan Center for Regenerative Medicine, we are, if you're a physician who's really interested in regenerative medicine, kind of want to make that part of your practice, if you really want to learn how to do it the right way, and have good success with it, and then base it off of science and then proper techniques, then you're welcome to come reach out to us, and we'll be happy to kind of show you the ropes.
Yeah, and one of our ideas is to work with the IOF, in particular in the injection technique portion of it, work with our labs and other good regenerative medicine companies that process the cells well. And then educate as far as patient selection, which is really the three variables that come to outcomes. But unfortunately, even with those three variables well known, there's a lot of barriers in medicine right now that just make it difficult for motivated physicians and physicians who maybe see the light and want to start offering this to patients.
Right.
But they're just stuck in the current rut of our current medical practice system, of a third-party payer system that, as of now, still hasn't recognized these options as being payable procedures, and how to help them make that transition so that they can start talking to patients, educate patients, mobilize their staff to start helping these patients as well.
Yeah, it's doable. We did it. We took the leap of faith, and we believed in this technology. We believed in this way of treating our patients, and we made mistakes along the way. So we learned a lot from that. It's the school of hard knocks, right? But hopefully with our experience, we'll be able to show other physicians that there's a way, and this is how we did it. It might not be the best way, but it's what's worked for us, and it might help you avoid some of the pitfalls that we encountered getting to this point.
Yeah. So helping trained physicians who have established practices and want to start incorporating regenerative medicine, both from a technique standpoint, but also from a business standpoint.
Yeah.
We are very much an open book. We're here to help our colleagues. And if you have a physician interested, if you are a physician interested, please feel free to reach out to us, and we can schedule a time for you to come in, take a look, and then really establish a training program tailored for you.
Yeah.
And mentioned our lab, Gray Ledge Technologies. For those of you who don't know anything about it, it is one of the first labs to incorporate regenerative medicine into orthopedic treatments. Got its start in Vail, Colorado, working both with the Vail Surgery Center and the Stedman Clinic, and now branches out and offers that same technology, the same equipment, the same standard operating positions, protocols, standard operating protocols, and training for the lab technicians, such that you can get the same quality procedures if you're to fly and have your procedure done out in Vail in any one of their affiliate programs. And we were one of their initial affiliate programs, not their first, but proud to say that we're the top volume producer for their lab. The lab we have here is as busy as any lab that they have anywhere else in the country, outside of Vail, and we're doing a good job of getting patients evaluated, treated, and they're doing an amazing job of providing a really high quality sample.
Yeah, they've been partners with us from the get go, and can be happier having them by our side too, kind of helping us along the way, making sure we get the best sample for our patients, and helping us push the field forward and getting the outcomes that we're getting. So again, it's nice to have a partner like that when you go through this whole field.
Yeah, prior to incorporating them, we were using bedside centrifuges, very high quality products. However, it's a one size fits all, and you don't get a analysis of the sample. So sometimes you hit the button, it comes out clear. Sometimes you hit the button, it comes out red. Sometimes it comes out pink. So you know that you're not having the same thing every time. And when it works, great. But when it doesn't work, it makes you wonder, what did we inject with? Was it a quality sample? Did it have the right quantity of cells in order to get a good outcome? And that question and that drive is what really drove us to find Gray Ledge. And it's been a very great partnership.
Yeah, I agree.
All right. So kind of, I would say that wraps up pretty closely what we feel like our biggest accomplishments for 2022. Our goals for 2023, if we have a little time. Are we pushing time here? So my personal goals for 2023 is to start to publish. So starting to get this data that we're collecting, these case examples of such great recoveries like ACL repairs that don't require surgery, regenerating ACLs, and get those case examples and then some of this pooled data that we have into the medical journals. That data is a very high bar to reach. Any of these peer-reviewed journals, when you hear people talk about scientific research, there's things called white papers, and there's things called peer-reviewed journal publications. White papers anybody can produce and throw out on the internet, and nobody has to validate what those conclusions are. Everybody can make the conclusions for themselves, whether they believe your data or not. A peer-reviewed journal has a validation process, a vetting process, where it's heavily scrutinized and before it's sent to publication. So I would very much like to get some articles in peer-reviewed journals, really help turn the tide on any of those. And there's still plenty doubters that regenerative medicine doesn't work. We need these articles and these data to show that if you do it right, if you follow the three and optimize the three variables, you can get excellent outcomes. If not equally good, I would say better than surgical with specific indications.
Yeah, I think you nailed it on the head, right? So for the longest time, we've been recipients of really good information, and we've been standing on the shoulders of giants in the field. And now I think by being able to push these studies out and pushing, our outcomes out, then it's our turn to kind of give back to the field,
Yep.
So which is, I think that's something that we would strive for in 23. And then,
So I'm saying it out loud, I'm putting it on the internet. It's there forever. Now, come December of next year or January of next year, hopefully in the review of our highlights from 2023, I'm able to hold up various different publications and accomplishments.
Yeah.
I guess with that, we leave a little bit of time for questions. Looks like we got a couple questions on the side over here. So let me see if I can lean in closer here to see them. All right. So you manage health insurance providers covering the procedures in the near future. So great question. Their health insurance. That would be a wonderful 2023 goal. I don't know if that's something that we're that close for. The first step in that is data. So any of the conversations I've had with any insurance carriers, they're looking for data that shows good outcomes, that shows improved function, that shows a decreased risk or a decreased need for surgery, and then cost of negative outcomes, so that these procedures don't result in any negative outcomes. I can attest to we have all of those things. We do all of those things. I don't have the data yet that supports it in a volume such that they're ready to start paying for these yet. I doubt that's going to be a 2023 accomplishment, but certainly I would say within the next 3 years.
Yeah. It's hard to say at this point, but for what we know right now, the only insurance carrier that we know that does pay for regenerative medicine procedures is active duty TRICARE for military. They allow PRP for the knee, osteoarthritis, and for the elbow for epicondylitis. So that's a start. That's a major insurance carrier. Yes, it is for a niche population in the military, but they see the data on this. They see the perspective on kind of how this technology works. So that's a good start.
It's a great start. Yep. Hyaluronic acid is a safe procedure to use for knees. Is it? Is the question.
Yes.
Yeah.
It's so hyaluronidase has been around for a while. It's a really nice treatment for a knee as a supplement or adjunct to steroid injections. The idea with hyaluronidase, it helps lubricate the knees. It typically, from our experience, lasts a little bit longer than just a steroid injection. There's outcome data that show that it's good. So I can say it's not good, but from what we can tell from our patients do enjoy some relief with that too. So it's another option that we have, and it's one of the nice things that we have here in the office is we take insurances too. Is that we offer not just cash-based regenerative medicine procedures, but we also offer your traditional medical procedures that's covered by your insurance. So we give you all these options on when you come in.
We had another question that came in for benefits of the supplements. So there are some supplements we recommend prior to particularly stem cell procedures, but in general. I'll let you comment on that.
So the studies have shown, like with quercetin and Pfizer, the other one, does show increase in the number of stem cell count. So we include that in our supplement recommendations. The other things that we look also with regenerative medicine is, the healthier the patient is, the healthier you are, the better your stem cells are. So it just makes sense to do that. So if we can optimize your health by making sure that all your vitamin deficits are met with multivitamin, make sure that you have quercetin and all the other vitamins and supplements that we need to, collagen, glucosamine, chondroitin, all that other stuff that we know is helpful for joints and cartilage. We add this on there too. It's one of these things that we don't know for sure, but there's no downside to taking it. And from what we could tell anecdotally, what we could tell just theoretically, is it should help. But again, exact dosing, we still don't know. For how long, we still don't know. But it should help.
Yeah. So we did do one set of data collection, and one of the sets of data that I'd love to get published in because we do count ourselves.
Oh, that's right. Yeah.
We do analysis of patients who have chosen to take the supplements versus those that haven't, and what that does for their stem cell counts in the ones that take the supplements have a higher stem cell count.
Yeah,
So
significantly higher.
we have a whole host of supplements that we recommend. So to Dr. Santana's point, boy, it's tough to say exactly which one of those is maybe the one, or is it the combination of them all? It just makes sense that it's going to be the combination of them all.
Yeah.
There's probably not just one magic silver bullet out there. You need to optimize the vitamin deficiencies. You need to provide your body all the what I describe as being the basic building blocks. If we're going to build a building, we need some concrete, we need some wood, we need all these basic raw materials, which is essentially what we're trying to make sure you're optimizing all your raw materials in your supplement regimen.
Yeah.
And then I think maybe one more question is about is PRP a good treatment for rheumatoid arthritis of the knee? I would say that depends.
Yeah, it's me too. It depends. So we use PRP to treat structural issues, right? And then but for rheumatoid arthritis, it's the structural issue resulted from an autoimmune problem that's attacking your joint. So unless the autoimmune issue is in remission or very well controlled, it can reattack your joints again, and then you're kind of back to square one. So the answer is it depends.
Yeah. Ditto. Yeah. I mean, we've treated plenty. We treated plenty of people with rheumatoid arthritis and other autoimmune diseases like lupus, and very successfully.
Yeah.
The ones that do the best are the ones that are also taking DMARD treatments, some sort of immunosuppression to manage the autoimmune disease. But if you have it, please come in. We'd love to take a look at you and tell you whether we think I think we can help.
Yeah.
I think with that, we better wrap it up. We had a couple more questions come in. Sorry we didn't get to them. Happy to answer those via phone, via email. Feel free to shoot us an email, support@mcfrm.com, or give us a call, 248-216-1008. Everybody, we appreciate you tuning in tonight. Hopefully you found it interesting. And hopefully next year we have even bigger and better things to talk about with our highlights from year end.
Yeah. Thanks again. And everyone, good night.
Good night.